The new NISCC Standards of Conduct and Practice were launched officially on the 30th of September 2015, and these articulate both what social workers and social care workers, how they need to behave, what their values and attitudes need to be, and the practice standards outline what social workers and social care workers need to know, understand and be able to do to practice safely and effectively.
Well, the social care workforce in Northern Ireland is the largest workforce of the health and social care system. There are upwards of 40,000 people working in the social care workforce right across Northern Ireland, in nursing homes, in residential care, in daycare, domiciliary care and community-based care. The role of the Northern Ireland Social Care Council is twofold. Firstly, it is the regulator for that workforce. So the council ensures that there are standards that people work to and ensure that they continue to work with those standards.
The standards of conduct replace the former NISCC Code of Practice for social care workers. These were first developed in 2002 on a 4-country basis and have not been formally reviewed or revised in that timescale. So within NISCC, we felt it was timely, 13 years down the line, given changes to the strategic policy, practice and service landscape within which social work and social care is delivered, to formally review the standards and to refresh them so that they were fit for purpose both now and into the future.
Well, I've attended the roadshow today because we are now in the process within the Trust of getting all the workers in all departments within the Trust registered with the Northern Ireland Social Care Council. Over half my staff are already registered and the rest of them will be registered before the end of the year. So I came along today for the information day. I have read the standards and the code of conduct and I think it's excellent, very well laid out and very simple in its approach and very easily read and very easily interpreted.
One of the other standards that we have added is around the need for compassionate, respectful and considerate care. This was a clear recommendation coming out of the inquiry into the Mid-Staff's NHS Foundation Hospital, and you may feel in some regards that it should go without saying that social work and social care should be underpinned by those values and approaches. But we felt it was important just to be very clear and unambiguous around that expectation that all that we do should be clearly premised on a kind and a compassionate and a considerate approach to those we work with.
Everyone will encounter a social care worker either directly or a member of our family because they work with people throughout Northern Ireland in their communities, older people, people with disabilities, and people who are in need of care. It's really important that the people who work with people who are vulnerable and in need of care work to agreed consistent standards and that they work to quality standards and that they're supported to do that and encouraged to do that, and that those who are unable to do that are removed and not allowed to work in that environment. So for that reason, it's really important that we have robust, consistent standards that we can test the quality of care and ensure that quality is of a high standard, because that's ultimately what we expect of our social care workers and it's what we expect as a community from them.
The definition of a social worker is someone who enables people to develop their full potential and cope with the trials and tribulations of life and overcome obstacles that might be preventing them develop their full potential. There's another aspect of social work which is about maybe ensuring people comply with what society expects from them, and that's where social workers will be involved, for example, within the criminal justice system or working with people with addictions. So part of what we do is about care and change and development and enabling, and part of what we do is about control and compliance.
Well, I think we're already working with those standards within the Belfast Trust, because any new workers in the Belfast Trust get a very good induction. We go through all the values underpinning their work, all the expectation of their work, that it is person-centred, that it is the emphasis on the care and needs of the service users, that those are foremost. And I must say my staff are very good at putting those at the very forefront before their own work needs as such. And I'm very impressed by the standards, and that they're very well laid out, as I say, very readable, very easy to understand, and essentially cover everything we do.
I think there's lots of different challenges. We often face service users who don't see themselves as having a need. We often face service users who have very complex needs, and maybe we don't have the resources to meet those needs. We face organisations and systems that are increasingly bureaucratic, and a lot of us get into this profession to work directly with service users and to help people make their lives better, and we don't often appreciate the amount of bureaucracy that can come along with that. So that's a challenge. And we're working within an environment where resources are diminishing, where needs may be increasing as a consequence of welfare cuts and austerity, where those needs may be more complex as a consequence of welfare cuts and austerity. So if the safety net in society is being removed, then who's going to be confronted with these needs? It's going to be social workers and social care staff.
Well, we all know that health and social care is under a certain amount of resource strain, and through that doesn't look like that's likely to change much in the future. There will always be a need for us to consider the resources that are available for health and social care. And so it's really important that we maximise the resources that we have for social care. And in that sort of environment, it is really important then that the individuals who work in that environment understand what good quality is, what standard is, and why it's important that they work to them. And so it's really important for us going forward that we constantly support people to be able to do that and to create the environment for them to be able to work well in their environment. It may well be that we will have to change the environment. It may well be that we will not have the resources available to provide the sorts of services that people demand, but we can certainly ensure that the staff that they encounter and the experience that they get from those staff is of good standard, and that the conduct and behaviour of those staff is of the standard that they would expect.
These standards, though, I don't think present a challenge for us in austerity. I think the opposite. They allow us as social workers to say to our colleagues and to our employers, this is what social workers do, this is what you can expect from us, and you need to support us in doing this. And if you're going to pull resources out of services, then we may have difficulty in meeting these standards. But the Social Care Council are very clearly saying in these standards that our loyalty are to these standards, and they will back us up.
The new standards of conduct and practice come into force on the 1st of November. So for the month of October, we are out there engaging in a programme of roadshows throughout Northern Ireland with our registrants and employers, really to promote the new standards and to begin to disseminate those and to ensure that people then can familiarise themselves with them, take them away, engage dynamically with them in the workplace and begin to embed them in their day-to-day practice.